Dear all SESP members and all participants, Assalamu alaikum and Bismillah ar-Rahman rahim. Today, I'm very much excited about our webinar topic because we are going to talk about assessment, and we are going to talk about a very key component of assessment, which is about assessment of blueprint. And I'm Dr. Shazia Iqbal, Head of CPD Activities, SESME Riyadh office. And I can see a lot of excitement from participants, and they are very much keen into topic as well as into our eminent speaker. And I'm very much pleased to introduce you our very much well-renowned medical educator speaker today. Very warm welcome, Prof. Hamza Muhammad Al-Ghani. And we are very much excited for your for accepting this invitation from SESME Riyadh office. Prof. Hamza Muhammad Abdul Ghani is currently Professor of Medical Education and Family Medicine, and he is Head of Assessment and Evaluation Center at King Saud University, Riyadh, Saudi Arabia. He holds Arab Board in Family Medicine and Fellow of Royal College of General Practice, London, and his Master's in Medical Education from University of Dundee. He is currently working as consultant of family medicine with special interest and expertise in curriculum development and assessment of undergrad and postgrad education. Professor Abdul Ghani has established the centralized assessment system in College of Medicine at King Saud, and he has supervised and established a lot of researches, and he's author of book, which is an essential guide for developing, implementing, and evaluating OSCEs, which is again very much important component of assessment. And today we shall get a lot of benefit from him on topic of developing blueprint in assessment, and we shall talk that what are different steps of developing the master's blueprint for course assessment and designing the framework when we develop this blueprint. So very warm welcome, Prof. Hamza, and this session will be recorded, and recording of this session will be shared with all participants by end of the session. So over to you, Prof. Hamza.
Okay, thank you very much, Dr. Shazia, for so detailed introductions. Okay, so I told you that I don't think you need introductions, but that was your usual habit. Okay, so our topic today is the assessment blueprint. And I did a Google form sharing with our participants, and we got very good. I mean, I was just looking at where we are and what I should add and so on. So as Dr. Shazia said, that we will share that form because there's a lot of other questions, and we hope that will be answered during this. Feel free to chat, to say usually that what we are doing usually, that we go through the presentation for half an hour to 40 minutes and so on, and remaining half an hour or 20 minutes will be for the question and answer. So you can, someone who have written already the questions, I ask at the end of the Google form that put your 2 questions, query, clarifications. So there I got a lot, but even though who could not do it, they can put in the Q&A. So Bismillah ar-Rahman ar-Rahim, alhamdulillah rabbil alameen, salatu wassalam ala rasulil kareem, sayyidina nabiyina Muhammad wa ala alihi wa sahbihi wa sallim ajma'in. This is our objective of sessions, to discuss the importance of an assessment blueprint, describe the steps developing, and this I saw through your things, that how we can do the master blueprint based on the PLOs, CLOs, and other content of the course. A different assessment method according to the course, design a framework for an assessment blueprint for course and its learning outcomes, and finally select appropriate assessment materials based on course learning outcomes in their cognitive, psychomotor, and affective domains. And if I just rephrase, because this is the one we know from long time, but the 3 domains, which nowadays in NCAA called as a knowledge, understanding, skills, and values. So those are the things to be included in our blueprint. Right. So the questions, yes, what is assessment blueprint? So let us just go for a few slides and have a look. That's any curriculum usually, or any say curriculum as a course, or it is a big programs and so on, or you take as a small activity, teaching or learning activity. I can say like these sessions. So any teaching and learning sessions usually based on three main domains or three main pillars. That outcomes or objectives, they're interchangeable sometimes, and sometimes very specific. And how we teach and how we assess. And that these three usually for any teaching and learning activities. And usually it is said that assessment is the most important part of that. We'll see. So just again to come to the background. So we do curriculum, we prepare curriculum, we develop curriculum, and then we give to our faculty, or we share and so, and we teach that curriculum. Take, for example, any course of family medicine, we have 6 weeks course. There is a planned curriculum, and it is given and communicated to all faculties, and we teach, and students learn. The question arises that, are we sure that what we plan has gone and for teaching, really this was taken for teaching by all faculties and so on? And the most important part is that the student really have learned what was taught. And so the discrepancy between the planned curriculum and taught curriculum and learned curriculum always can happen, except you have really very reputable assessment systems. So assessment really is going to cover all these three domains. That's the one. I think many of you will be aware of this 6 steps approach to the curriculum development. And this is by the Professor David Kern from Johns Hopkins. He put as a 6 steps, starting with the need assessment for the curriculum and is contained and so. And then what need assessment again for the student who's going to learn and so on. And then he said that how your objectives or the goals you have written, it has to be measurable and kept in that. And then we execute that curriculum through the different strategy, educational strategy, and implement it. But it's not enough, you have to evaluate. Usually American, when we say evaluations, they mean assessment and evaluation. So through the feedback and so. But according to him, that this process is not end at the evaluation so on. It goes and again come back. And if you remember, anyone who is, and I saw when I was reviewing your answer on the Google form, so majority of them, they are academic. They are really working in academia, in college or university and so on. So you know that when we finish our course, we write course report. And there we put some evaluation and survey and so on, the results of that. And then we next year, we really take action for that. So assessment is the one, and you can add to it evaluations. That really is going to make the curriculum continuously running or continuously developing and improving. All of us, we are aware of this NQF domains. It was after changing from the 5 domains to the 3 domains. And again, the 3 domains 2018, it was knowledge, skills, and the competencies. Some of us, we really objected that the competency is nothing but the knowledge and skills. And then it was changed in 2020, knowledge and understanding, then skills and values. It is important that all these has to be mapped to our own program learning outcomes and has to be calculated and given the weightage for each of these. That have you really assessed the value? Have you assessed their skills? Have you assessed the knowledge? And so on. So if we have in our minds these backgrounds, so then we can think that why the assessment blueprint is important. Now, all of us, we know that this is our SaudiMed with the 6 domains, and this domain was transmitted into the 17 PLOs. And this is the minimum criteria from the NCAA that we have to apply to our curriculum. And so majority of colleges I have seen, they have already mapped their PLOs to this program learning outcomes of the SaudiMed. We in King Saud University, we have taken is 17 as it is, and we are just going through that, and we thought that it is almost complete. So taking this background of program learning outcomes and NCAA domains, and at the end they ask you that show me how much you have achieved your program learning outcome, which was really planned for that. So blueprint is fair and logical representation of the content of your curriculum. So fairness to the student, clarity of the test developers, avoiding context or the content underrepresentations, or it can be avoiding that something which is irrelevant. We as a faculty, all of us, PhD holder or the fellow or the board holder and so on, we are expert in our field and our domain, but is that undergraduate level what we really need? It has to go through the course learning outcomes and program learning outcomes. So keeping the assessment in line with the curriculum intention, that's the most important. That this curriculum is for the undergraduate. I'll give you, for example, so usually we have a curriculum committee in our college, and sometimes they bring some new ideas to be included in curriculum. And once they brought that intensive care unit is not represented in undergraduate curriculum. It has to be a small course on the intensive care unit, and it was discussed. And we said that really it is within the curriculum. Is it somewhere? They said, oh, it will be about the emergency. I said, emergency we have. So therefore, it's very important that why curriculum was really developed. That's very important. What was the intention of that? So again, it is referred to the process where the test content is carefully planned against the learning objectives, or you can say the learning outcomes. So that's very important, that what we are really doing. So it specifies the objectives that are to be tested in the given examination, as well as their relative weight on the examination. So we cannot take all objectives. If you take, for example, we have only 3 main domain of the NCAA. Under that, for us, our outcomes are 17. And under that, we have 33 courses, and each courses, they have almost about 10 to 12 course learning outcomes. So 10 to 12 learning outcomes, we multiply into the 32, it is 320 outcomes. And how all these can be really, how much they're weighted from in that. So first crucial step in developing a valid examinations. So here, the most important, that the validity of our assessment or our examination is really assessed. So for content to represent the curriculum, ideally assess all we have taught. So assess the whole curriculum. So if we say that our curriculum is based on our 17 program learning outcomes and we have 32 courses, we should assess all these. Then we can say that we have really assessed and we know that they have achieved what we intended to do that. But it is not really practical. We cannot do the whole. Therefore, we have to do the sampling. So curriculum, the whole curriculum usually sample. So we have 32 courses. So we can sample each course, what we are going to put in exams. So course having the 10 learning outcomes, maybe these 10 course learning outcomes are taught. Say, for example, 50 or 60 topic or sessions or practicals and clinicals and so on. So we are going to really take the snapshot of all. So that's the exam. So we are really going to take that. Exactly like research. If you are doing that blood pressure of male in Kingdom of Saudi Arabia, we cannot take the whole population. So we usually get the exam sample. And again, if we take a tumor, which is, and we want to do the fine needle aspiration biopsy, so again, we are going to take the sample. So it is the sampling method, that's the assessment, and you cannot do the sampling method except you have. So usually we say that research, they ask that what type of sampling method you have done. So if the sampling method is really represent that your samples, that representation of this sample is through the blueprint. So content validity, that's the sampling. I think all of us, we know the Miller parameters. So he put as a knows how that is really the theory or the cognitions, or as you can say, that it is knowledge and understanding in case of domain of NCAA. And then we have the show level, which is the skills and so on. And he added the real practice. And each domain have their specific tool to assess. That's very important. You cannot assess skills through the MCQ, and you cannot assess real practice through just only doing the OSCE, but it have the different level of assessment and different tool of assessment. So no single assessment to assess all levels and competencies. So very clearly, George Miller has said that no single assessment method can provide all the data required for judgment of anything so complex as delivery of the professional service by successful physicians. So look at, there's a really collection of the data. So it is something like research. Research cannot be robust and not the real representation, except you have the collection of data is really based on the scientific sampling methods. So, sorry. Okay, I just got back. So, blueprinting, nothing but the mapping what and how to assess. So, idea on what and how to assess, that's the detailed workable plan. So, this is really the plan. By the way, usually the blueprint, and I mean, the word has come from the architecture, where usually when people used to plan, or it's still now, but nowadays it comes from the computer, but usually people used to draw. The engineers used to draw on the paper, and that paper was blue. So this is your house, which is 3 stories. This is the landscape, but this is your dining room, and this is your bedroom, and so on. So that was the blueprint for that. So this is exactly like that we are planning for our assessment. Okay, so if we are talking about the content validity, is the exam, so what is this content validity? Is the exams really assessing right content? So are we are going beyond what we have planned for, or we are really underestimating the student? And always I say that assessment is the responsibility given to us from our university or from academia or from our institutions. But this responsibility is also, we are responsible in the Allah subhanahu wa ta'ala, that He will also ask us that if a student who deserves to pass, and if we fail, or a student who deserves to have A+ and he got B, again, we are responsible in the Allah subhanahu wa ta'ala. So the quoting from Quran, always I say that in the hakamtu bain an-nas an tahkumu bil adl, if you want to do judgment between the people or judge the people, so you have to be fair. Right. How we can ensure the content validity? That content validity have two important parts which should come in your assessment blueprint. Content should represent the curriculum, so sampling has to be very well, and assessment method should match the content. To repeat, we cannot assess the skills by cognitive methods like the MCQ or SAQ, and you cannot assess the other things with the other. So therefore, two things very important: representation of the whole curriculum, how it is representing, and sampling method is correct, and also the correct methods. So usually it is grid, or it is table, or they also call it table of specifications, and so on. So axis 1, disease and condition. So you can maybe, you say that, what are the diseases or what are the conditions and from where they're coming? This. So you divide them into the majority questions, some questions, and few questions. That's the one axis. So majority of the questions should be common, high impact condition. High impact condition, which could be treatable, which is important and common. Microinfarction is common, which is high impact if it is taken very fast to the emergency given the treatment. Or some question which is uncommon, but still the interventions change the prognosis, like SVT, pneumothorax, if it is not taken at the time, so the student should graduate. Or some few questions where they are imported by medical or clinical concept, like galactosemia or phenylketonuria. They should know about it. So this is the weightage, where majority of the questions will be from the high impact condition, and some of the questions from that area, some other, because we also treat galactosemia and the phenylketonuria. Or the other axis could be age and gender distributions. So there should be, when especially if you go to pediatric or to the medicine, so there should be some cases. In case of medicine, some of the old people, some of the young, so things are, so that again, adult, elderly, woman, man, even the pediatric, the neonates or the toddler or adolescents and so on. So it could be, the other axis could be the third axis, the health services illustrations. Is it the case which is always in the hospital? We are very keen to bring the things, but there's something in their community. So you have to think of the ways the health systems or the family or the community, or you're talking about the individuals. Is it, you're talking about the prevalence of the whole things and so on. So further axis you can also add to what is really needed from the students. So data gathering, interpretation, management, or level of difficulty, it is low or moderate or high, or it is really we need all applied questions, or it could be some of them could be other recalls. All these can be differently can be distributed. This is a very nice paper, which is quite old. It came into 2006, but really showed that how best you can go with all these starting with system, problems, and content area, age-wise, clinical task, and so on. So this is, we can say, this is the real master blueprint. I will show you some of our own, but this is from Professor Hussam Hamdi, I think, very famous guy and he in the medical education. So he put what are things we can, what are the tools we are going to use here. So he put OSCE, he has put the OSCE written as other things, and capable reading and so on. So all these, so that's the whole plan. And then from this plan, you can take for the individual cases. How? Usually we draw tables, rows, columns. You can interchangeably, you can put the content on the row or on the column. We are putting really our content on the column, and we put on the row the outcomes and so on. But it can be, and I mean, there should be x-axis and y-axis, and fill the cell of table with the appropriate assessment methods. So if all these filled, so then you can say that this is the master blueprint where all these are there, and we'll show you some of our things also. So this is the master blueprint where, so in master blueprint, you have to have your whole objectives or outcome. You have to have the whole content area, and then all types of assessment methods which is used. So we have the objectives, we have the content area, and we have the assessment methods. So that's called master blueprint. So this is the master blueprint. Say, for example, I have a course where I'm assessing through the MCQ, through the short answer questions, through OSCE, through OSPE, through oral, and whatever. So all these should come. And then you can take these different assessment methods to the specific blueprint. So from here, we can take that the blueprint for MCQ, blueprint for OSCE, and so on. So for a given exam, select the cells that you want to construct questions, and that's the really exam blueprint. So this is the blueprint. When the people, they come and submit to our center, so we say that you got the blueprint. So MCQ blueprint, and we found sometime that, this system or this topic, which is important, is not covered. So they have to put the whole topics or sessions, or we can say lessons, and then they select from that. And they say, this time we are going to do in the midterm, this is going to do in the final, this is for the repeat exam, this is for the failure exams, and so on. So that's a very brief. Let us just take some tips that how really we prepare. So don't forget that in master blueprint, we should start with the NCAA domains. NCAA domain means that you have to have your PLOs assigned with or aligned with the NCAA 3 domains. That's the knowledge, understandings, skills, and the values. Then you put your PLOs, and then you map CLOs. So start with what you assess and how to assess, and develop sensible grid customized to the given examination. And we'll see some of these examples. Now, so start with the component with major weightage such as MCQ, MAQ, SAC, OSPE. Sometimes they bring also that, we are using also some of the small quizzes during our end of this, and so on. So all these you can put there. Develop the blueprint at very beginning of the academic year. So usually what we do, what our practice, that we need first beginning of the within the first 2 to 3 weeks, you bring it. Usually sometimes they do it the first week. They bring that this is our master blueprint. And then with each exam, because all exams are really centralized, With each exam, they bring their blueprint. Sometimes, some people, they say, oh, it's very difficult and we are not able to. We're doing a lot of workshops for them. So even that, so we have our blueprint and we ask our faculty in the center, they fill that and they try to find out if there's any gap. Very important that don't go very much off the axis or the dimension. Because as Professor Sam Hamdi showed, so make it as simple as possible that people, they can understand and you can understand and so on. So raw, column, and outcomes. So raw, they're having usually content and column having objectives or vice versa, and the outcome, and then you can add outcome your own, or some of people even they map it through the CanMed and so on. For all, majority of, not all, majority of our postgraduate are based on the CanMed. So I'm just repeating the learning outcomes. It is a clinical skills. Assessment of object, a student should be able to carry out urethral catheterizations, for example. So if I give short answer questions, write short notes on urethral catheterizations, and they have learned, there are 10 points in that, and they write. So is it important? No, because assessment method does not match the learning outcomes, assessment objectives. Therefore, the selection of the tool for assessment is again very, very important. Now, this is one of our template for what you call, maybe it's not be very clear, but I can, because this is just, I have taken the screenshot. So this is the first row, just I told you that it could be interchangeable. They say that the row you can put the topics, and then here will be that. It is same. So this is NCAA domain, knowledge and understanding, and then this is the skills, and this is the values. That's the 3 domain of. So we have covered this. Second, that our 17 program learning outcomes, that's in the form of Saudi Meds. We give this template. This is the empty template. I cannot share the others, but this is the empty template. And we say that put here your course learning outcomes. So each courses have the 10 to 12 learning outcomes. Please keep on putting your questions, and so that we can. So I think PLO, the program learning outcome, CLO is the course learning outcomes. So course learning outcome is in that. Very important that not all course should map to the all of these program learning outcomes. Some of the course will go for 10, 12, 5, 6, whatever. But your all courses, like for example, for us, 32 courses, they should really cover all these. And we say that why it is important to cover all these. We give all them for them that you can select. So these are the domain which is under the knowledge. So you can select the suggested teaching and learning strategies. So these are some suggestions from our side, and they take what they are doing and they take out what they are not doing. And we again suggest that what are the, sorry. So yeah, so what are the assessment tools you can add to it? So these are the 2 areas, how you're teaching, how you're assessing. So see, it is a very good alignment with your domain, your program learning outcome, your course learning outcome, how you teach and how you assess. So now you are sure that, and here we say that either you go with systems, usually like the medicine, they come with the system, cardiovascular system, and they put underneath the topics. So this is myocardial infarction, this is ischemic heart disease, this is congestive cardiac failure, and so on. So this under that, and then the say CNS and headache and so on. So system, and then you put, like for example, family medicine, where I'm involved in that. They don't have system-wise, so they have about 40 topics, so they're put under the topics. So it could be whatever, but you have to put, with this one usually we taken from the tables or syllabus, which is distributed to the student and others. And then we say that select what are the assessment tool is there. So they will put here. So some of the, if it is skills, usually it go for the OSCE, it will go for workplace-based assessment, like the MINISEACs, DOPS and others. If it is mainly the knowledge or understanding, so it will go for the short answer questions, or it goes for the MCQ, and so on. And finally, the values and how you're teaching. So it is sometimes a continuous assessment, sometimes through the small group discussion, scenario, whatever it is. If this is the one which we call it master blueprint, this everything is there. All what you have taught, it is here. All your courses which you are involved is there, and you put your all these things, and then you take out. So now when you're presenting the MCQ, so some of your topics through the MCQ, some of the topics with the OSCE. So here, this is the blueprint for the MCQ, and again, it is mapped with the course learning outcomes and so on. And you put, so this is the topic 1, you have covered here 1 and 2 and 3, it gives you the number of the questions. So total number of the questions, how much, and then accordingly, so usually we say that if it is a midterm, usually you go for the 50 to 70 questions, and if it is final, you go 80 to 100 questions. And if you are having that OSCE or other exams, again, you have that the blueprint. So it is all these taken from the master blueprint and so on. Whatever the else, sometimes the people they add MCQ and short answer questions together here. Some of them with the short answer question, some of them with the MCQ. So in summary, we have our program learning outcomes, which is taught with the several course learning outcomes and through the different units or modules and so on. And it is the teaching learning activities, what we call lesson. And at the end of each, we have assessment or exam. Should be the continuous, should be the, could be it is the final, and all these should come down. Why it is important? Because NCAA at the end, they will ask you at the end of the year that what they call the program report, and there you can say that how much of your, if you have your own PLOs, so this should be here. So your own PLOs and how much you have covered those through the different courses. So this is what we call the constructive alignment of teaching, learning, and assessment. Always, some of the people, they ask, shall we do it? Or you people as the exam center, or the quality people, they should know. It depends on that what things. Usually we say the course coordinators or the committee members, they usually present that. Why it is important? Because NCAA, again, the standard of the program accreditation, it is very well written, and I'm not going to go details, but everyone, I think, having this, I'm not sure it has been, because it is from, it has been maybe, now it's available 2021 or something like that. But they very clearly, they say that how these under each subheading, that how this is needed for to align those with the things and so on. In 2020, they have written people, they feel difficulties to assess. Still, in our college also, very little questions on values. So if you don't put, so you will go, if you just see this, if you go with only your own program learning outcomes, so you forget that there is something called value has to be assessed. So therefore, all domains to be assessed through these things. So there is a really standard, and you can go. always when we do some workshops, we refer to this. You can download from the NCAA Reasonings, and they have written very clearly that what we need by the knowledge and understanding, what we need from the skills, and what we mean from the values, and this is the details of that. So it is really, now if you look at the skills, they have, if you remember, in the 5 domains, the cognitive skills was under the knowledge, or separately there was knowledge and cognitive skills, and then the communication, IT, and psychomotors, and so on. So under the skills, that the cognitive skills, or what we call it as a theory, which is applied, and so on. And then the practical or physical skills, that is the psychomotor skills, and also communications. So under skills, don't forget that all these cognitive skills and practical and physical skills and communication skills under this. And then the values. Again, values also has been, so it is autonomy or the responsibility, and values like the ethics and other things, autonomy, responsibility, and how really you teach and how really you assess. That's the really difficult job, but you have to do it. Okay. Let us give you some more examples from different places and so on. So this is from our friend Professor Zubair Amin from the Singapore, that this is for the the system they have put there. And here the domain, what they want, history, taking physical examinations, and so on. I've taken that permissions to share with the people. Again, for that, and how for the OSCEs and so on. This is again the different types, that what you need and what are the domains to be included in that. So if we summarize the content validity, so does test material represent the curriculum, and is the test method is appropriate? That's the real content validity, and so on. So is the exam assessing the right, as we said, and content should be matched with the assessment, and content should be represented the curriculum exam blueprint. Don't forget that you are responsible in front of your quality in university, quality at the university, in college, quality at the university, and also the quality at NCAA. So they will be looking that your outcomes and your teaching and learning methods and assessment, really it is going towards their standards. At the end, I should thank our 2 colleagues that we are working together from long time, Professor Zubair Amin and Professor Govinda. And some of these slides are shared by these great people and so on. These are certain reference for that. So thank you very much for listening all these. And then, Dr. Shazia, you can open for discussion.
Yeah. Thank you so much, Prof, for this wonderful and insightful presentation. No doubt, as a medical educator, constructive alignment between teaching, learning outcomes, and assessment is very, very important, because we don't want to assess which we don't have any objectives, and we don't have taught, and we don't want to lose that to be assessed, which we have taught, and that is required to be assessed to graduate our students. So this presentation was really amazing, the way you have explained the examples of blueprint. I'm sure at different institutions, different people are using in different way. However, this is a good forum that you can share your experiences and you can ask your questions. So far, I can see a few comments in our chat box. So there is one question by Dr. Muhammad Shabib. My question is regarding the assessment of short courses, for example, 2 or 3 credit courses. If the content is less, then what is minimum acceptable number of items, MCQs, to be reliable or valid results?
Thank you very much. I think it's very, very important questions because people, they get stuck. In our centers, we have announced that 50 to 70 questions in mid and 80 to 100 as a final. But it's really, and it's a short courses, maybe you cannot reach that. But through these questions, you are really covering. You have covered that. Sometimes they bring 100 questions and they say that, Prof, I'm not going to use all these because I have, again, the final, and we have to, again, some of the failure students and so on. So it depends on how much really you have mapped those questions. That's the most important one. You're not missing really some good things. This is the one thing. Second, because people, they get difficulty to prepare new questions. And these questions all will be with your student bank. So that's, again, you have to be very careful and try to have some idea about that, how much we are going to use as a used questions. In our college, our regulation is that 30% can be repeated and 70% should be new questions. And these 30% questions should not be from the past 2 years. So again, not the number, but the coverage, what you're really going to have. If you have some software and so, it can give you some reliability by just looking at those things, or you have to do through the Excel. Some of the people I've seen that they do through the Excel. But if your objectives are covered, you are having all three domains questions, all topics which have been discussed are inside and so on. So that's, I mean, really. And if you go for, say, for example, MCQ, in MCQ, we usually go for the histopath, for the basic science, pathophysiology, and so on. Then we go for the presentation, we go for the diagnosis, we go for the management, we go for the lab investigation, we go for preventions, and so on. So look at these, the wider area, all we are really covering or not. So that's the beauty of your blueprint, that it can really tell you. But there's no magic number that is a small a course should have this much and the big course should have this much. If anyone says you want to really share it, we are here to hear from others, their own experience.
Yeah, you can raise your hand and can directly start discussion if you want. There is one very common question which Dr. Faisal Ikram, he has mentioned here, that how would you plot a block covering a structure function relationship at year 1 level which don't have value and psychomotor objectives? Because Saudi Med says that you have to assess knowledge, psychomotor skills, as well as values. So, but if block is very short and it's at very early level where we are only teaching knowledge, how can we create a blueprint which can assess other skills as well? Values,
I think it's very, very, very important. Again, questions for Dr. Faisal. Thank you very much. See, I have seen many places that because this is a first year and we usually teach only theory, there will be some area, but you're not teaching. If you're not teaching, so they're not necessary that you have really, like in our, I think our curriculum, and not much difference from the Al-Faisal university, that we have integrated blocks. I have several times I have reviewed your assessment for the college. It has come to us for the revisions and we have done it. But what I'm trying to say that in, say for the example, cardiovascular system, cardiovascular block, and in that we don't have much of the skills, but we have skills of that, how to take the blood pressure, how to take the pulse rate, how to listen to the heart, and so on. Very simple. And we usually give them 3 OSCE, only 3. And they know that this is the one. it will come blood pressure, it come pulse, it can come, and we can comment on that and so on. So, but if you're having really, and I have seen these are the things not much in the applied science, but usually it is in the theory. So they have only. So if you have only theory, it doesn't matter, because these values and skills is not necessary that has to be or all. And let us don't just say incidentally domain, but you look at the SODIMED. SODIMED is a 17 competencies, and these 17 competencies cannot be assessed from the one block. I have seen that never, maximum they go for 8 to 10 out of that. So, but the other block, they they are going to compensate. So if first and second year, they are doing here and there, and so you will find out. And at the end, our 33 or 32 blocks or the courses are covering all these 17 and all these, the domains of density therapy and so on. I hope that I answered the question for the professor.
Yeah. There is one question by Dr. Doa Adil. She has mentioned that how we design a blueprint for theoretical and practical examination in integrated curriculum. For instance, in CNS module, which include many subjects like pharmacology, pathology, microanatomy, is it acceptable to just calculate weight for each topic, or is there any other way?
So again, we have also integrated our CNS, and if again, let us go for master blueprint. Yeah. So if you look this master blueprint, and here you put this all your topics of a CMS, whatever it is. So it is meningitis, it is headache, it is, and whatever it is, any throw that is epilepsy. So you have put all these. You teach them all through the your lectures. You teach them in the lab. You show them certain specimen and so on and so on. So all these, and then see that what can go for the MCQ, what can go for the OSPI, we call it, and we take it for them as OSPI. Even like, say, for example, the CNS chart, that for what you call seasonal chart, Ishihara chart, how they can interpret and so on, and how they're going to do that, or looking for the certain pathology and so. So they divide that how much. It is not fully integrated still, but what is the histopathology? They are histology. They are showing that. So they are showing that really only the nerve cells and the axons and the synapses and whatever it is. Now, what is the pathology? They are showing that. So they are showing certain, CNS, for example, the results, or microbes, or meningitis and so on. So it is taken from different department, and we usually go for OSPI of 12 numbers. All this. So this is the one day. So for CNS, we are using it. MCQ, we're using short answer questions, usually based on the scenario. And in that, because short answer questions, and sometimes they call it modified essay questions. I've seen in the Singapore, they call it modified essay questions. So scenario of a patient who presented with the headache and neck rigidity, and so looks like meningitis, what you're going to do, and this is the lab results and so on. So this is again theory. So we do MCQ, we do short answer questions, and then we give them also what you call OSPI. So objective restrictive practical exams, and also they will be assessed on OSCE. I like that. How can you test the vision, and how you can take the history of a patient presenting with the headache, and you can classify what is it.
Yeah. Thank you. If somebody want to ask question, you can directly unmute and can ask or pass comment. There is one question and concern by Dr. Ajalan. He has mentioned, although it's not related with blueprint, but generally with the assessment, that what is acceptable number of stations or time to say OSCE is valid and reliable?
Very, very great questions. Yeah.
So they know that you are assessment expert, so maybe you can
yes.
address this
Let
question.
us give you some story from our own things. In family medicine, because it is a short course of 5 or 6 weeks, 5 weeks we teach and 1 week we go for these things. So in very early years, there was no OSCE. And we used to assess them in the short answer questions and so on and so. So I was pushing for 2008 when I came back from Dindi, and we started to pushing for the OSCE, and they say, oh, very difficult. And so when we started with the only three stations, and then they have improved from the 7, sometime 8, sometime 10, but usually it is 7. Rule of thumb, they say that should be 10 and more. But there is a calculation for your reliability, and there are really some work can be done, and you can find out that how in your OSCE stations, how many really needed. I was in Dundee, and we were doing the work for calculating the reliability of that. So that, and I think that time we had 10 OSCE. So the structure of your OSCE, it can give us some values that how many. So when we calculated that time, the reliability of those 10 questions was 0.68 or around 0.7. That is really acceptable, but not very high reliability. So there is another methods to calculate that how much we need. And when we calculate, it came to 25. I said, my goodness, that was Professor David. And he said, Prof, how we can go for 25? It is, then he said, you have to improve your OSCE. So it is not only the number, it is again the constructions of OSCE. It is people, they say that people are moving from stations to stations. OSCE is not. So OSCE have really, and I mean, constructions need a lot of work for that for OSCE. So more is better, but again, there's a lot of logistics and so on, how we can do it and so on.
Yeah. Yes, Dr. Karimuddin Saleh, you can unmute and can ask your question.
Thank you very much, Prof. Hamza, for this elegant presentation. In fact, the beauty of this presentation, it connects not only distribution of the question, but it is relationship and alignment with the BLOs and CLOs. However, I have one common question and another common comment. My question is that in literature, some authors, they believe the blueprints should be published to the student. However, they mention that it will not add to performance. It will not improve performance, but it will create an atmosphere of fairness and transparency. What is your opinion of publishing the blueprint to the student? The second thing is a comment. I expect that you will consider one of the methods for determining the weight is the importance, where you multiply the frequency by the impact of the condition. And this, I think, work well in an integrated course, because when an anatomist or a basic scientist sit with a clinician, it creates good communication and they can correlate things together. So what is your opinion about this process? Thank you very much.
Thank you very much. Both are the very important questions. See, the first questions that announce to the student, yes. not that details, not that in its integrity that these are the things and which are going to ask, say for example, headache, and they're going to ask in the history taking and clinical examination only, which will not go to the treatment, so on. Not in that way. But we say that your questions are related to the course learning outcomes and the objectives of the sessions. So this, and we always, after exam, if it is MCQ or whatever the exam, they have the opportunity to, within 48 hours, they can object on any questions, and they say that this question was not from the objectives, because they know that their questions are based on our objectives of the session or the course learning outcomes per se. Even the feedback given to the student, strengths and the weaknesses, because we are using the exam soft, and they very nicely, they link the questions to the CLOs that can be done. Coming to your comments that see, the integrations are the ladder. How much really it is we are in the first ladder, or it is really on that. And I've seen several courses which not really integrated. But this is the way that we really discuss with our colleagues, and especially who are in basic science. And we found that including clinical assessment and giving them scenario-based questions and scenario-based short answer questions, this is the best way to come to the going the up ladder of the integrations. So if we put a scenario of a patient who's presented with the headache, and it could be a simple headache, migraines, or the cholesterol headache, or it could be a headache of nervous system infection. And so what could be the different diagnosis and how you're going to approach that? And if it is come to the meningitis, what are the else to be done, and so on. So a scenario with following the 5 or 4 short answer questions gives some integration, especially in case of basic science. I hope that I answer your question.
Thank you very much.
Thank you so much. Yes, Dr. Khalidoon Marwa.
Assalamu alaikum.
Alaikum assalam wa rahmatullah.
Prof. Hamza, Abu Ahmed, how are you? Are you okay?
Fine, thank you. Jazakallah khair. Your sound is interrupted. Yes.
Hello.
We cannot hear you, Doctor.
Hello.
Hello. Yes, we are here, but we cannot hear you well.
Apparently, maybe the internet is not that stable. Okay.
Now it's okay. Go ahead.
Okay, Jazakallah khair. Again, I should thank you very much. Highly appreciated, informative presentation. If I just allow me to, make sure that I got you right, talking about the screen now, that what you presented now, what is appeared in the, the master blueprint. Let us say for, the system and, on the topic under the last few lines of the screen, you wrote here MCQ and OSCE if it is knowledge and whatever the topic. Let us say if we're talking about depression and manifestation of depression, and so it will be MCQ, right? If I understand it, understand it well. And what about the skills? Should I just discover depression, for example? And should I say that, well, this is modified question or OSCE again? And should I write this here for each topic? And I just give an example of depression or anxiety or whatever. So, and then the second question is, should I write the number of the MCQs or MEQ or OSCE, the number of MCQ in manifestation of, for example, depression is 1 and the other things is 2 and so forth. Please just clarify this point, Abu Ahmed.
طيب, Abu Ibrahim, Jazakallah khair, very good questions and very practical. So now, let us take depressions because you're a psychiatrist. So depression, having a theoretical background, theoretical knowledge, and it has also skills. It also has the values, ethical issues, for example. So if you want to assess depressions, so you can have the in MCQ, and it come like that what is the pathophysiology, basic science, how it could be diagnosed, how it could be investigated, how it could be managed, how it could be prevented, and so on. So that's the MCQ. But if you come in to clinical skills, so you need that how did a person can have the history taking, how you can, in that they're going to do the clinical examination, mental or whatever you can say that. What are the investigation can be taken? An old man who is presented with depression, it could be a hypothyroidism, for example, ignore my ignorance. How can you communicate with the patients and so on? How you can manage? So one session or one lesson, always we say, that can have different domain. But let us see in that way that we have enough questions in depressions, in MCQ or in short answer questions. I'm not sure that I'm going to add, because it's very difficult to really portray or role play the depressions. So I'm not going to include in the clinical, but I have taken that in the more of this one. But other things I can take in examination. So one topic can be assessed. That's why the master blueprint, you can, depression, you can add even ethical issues. If the patient is coming and a relative are coming and asking that what he's suffering from, now what's the ethical issue here, and to be then so what's the values of that, what's the confidentiality, so that's about your coming to the number of the questions. Again, there was someone has asked, is depend on that what are the things you're going to really test, and what are your, say for example, psychiatry is a very small, again, course. So how much you're going to cover? If you're really covering all these, look at the domains, look at where you're going to cover this, your SODIMED, your own PLOs, and also how much you're going to cover your CLOs. So each course have the CLOs. They are 10 to 12. Now, how much I'm going to cover those in here and there. So it's all depend. That's why the blueprint, the whole idea of blueprint, that you're planning well. And if you really plan well, then you're not going to miss. This time I have included depression as a theoretical assessment. But the next time I'm going to other exam, I'm going to assess mainly history taking. And if a student, he could not identify about the suicidal things and so on, that's still having to be compromised and so on. So that's, I hope that I could answer your questions. That's why the blueprint and blueprint and blueprint, starting as master and then the specific blueprint.
Thank you very much. Jazakallah khair. Unfortunately, I lost the internet. I got it again, but I got some of your information. Thank you very much. I will not bother you again. Okay, thank you very much.
Thank you so much. I think all of the questions has been addressed. There is never ending for questions and there is never ending for knowledge. But I would say that this is a wonderful webinar and an excellent presentation to summarize what's the importance and significance of blueprinting and what is underpinning behind it. And I would really appreciate Prof. Hamza for your efforts and time to give us for Saudi Society for Medical Education and your input. And I'm very much pleased to see excitement of participants. And it was more than 130 participants, very live and active. Thank you so much. I think it's time to say goodbye now. So I will share a recording of this presentation with all participants who attended. Thanks for your...
Excuse me, before the closing, could you please just tell us how can we access the recording? So because of the internet, I have many interactions. Is there any, recording access, any link?
You have already registered to this webinar. Yes, so yes. To all these emails we received and the registered participants, we shall email the recording link.
Okay, thank you. Thank you very much. Highly appreciated.
Yeah, sure. Thank you so much, Prof. Hamza. Nice to see you.
Thank you very much. Yeah, thank you very much for all for your all this effort and all participants, their participations and so on. We hope, I was just going through it because we don't have time. I was going through that Google form and I found that those are the questions which has been raised and I think it has been answered here. So no need of going further again. Thank you very much.
Yeah. Thank you, Prof. Have a good night. Bye-bye.
Good night. Bye-bye.
Thank you.